Even though Medicare supplemental plans, also called Medigap policies, are written for life and can never be canceled by the insurance company, would there ever be a reason why you would want to change your MedSup plan? And the answer to that is yes. In this video, I'm going to show you why and the easiest way to do that. Now, we're going to get into the details of changing Medicare supplemental plans, but before I do, I just want to do just a quick review of a couple of items. Number one, what is the main Medicare decision that we make once we decide to go on Medicare at 65 or later whenever we retire? Well, there's actually two options, and this would be your decision. Number one, you're going to have to choose how you're going to use your Medicare benefits. One option is to stay in what we refer to as original Medicare or traditional Medicare A and B system, and then because of financial liability with A and B, always get some type of a Medigap policy so we don't have that financial exposure. That's one option. The second one is actually to replace traditional Medicare A and B. You replace it with what? With a Medicare Advantage plan. These are also called C plans. So the point is, when you make this decision, it really is going to be crucial for the kind of coverage that you're going to have. Let me explain the differences. There are actually 7 main differences, and I'm going to quickly highlight for you, but I do want to let you know there's one thing they do have in common, and that's this. In order to have a supplemental plan or an Advantage plan, I must be enrolled in Medicare A and B. Now, for the majority of people, Part A has no premium because we have 40 quarters paid into the tax system, but B carries a premium. Now, for 2025, most people are paying $185 for their Part B premium. Now, if you're someone that is a single filer and you make above $106,000, you can pay more. If you're a couple that makes above $212,000, each of you could pay more. Those are called IRMAs. They're actually surcharges added to Medicare B and D. But my point is, in order to have either plan, Advantage or Sup, we're enrolled in Medicare. Now let's talk about the differences. Number one would be this one. If you decide to take a supplemental plan, what you're doing is you're electing to stay in the original Medicare system, and you have doctor and Medicare managed care, meaning the insurance company has very little say-so. Actually, they have no say-so. They follow Medicare. But here in this system, your doctor and Medicare are making the decisions. They are the ones managing the care, overseeing everything, approving everything, really deciding and directing that care. So you're basically under that supervision, under that system. If you decide to take an Advantage plan, it's different. Now you have a private health insurance company that is managing that care. They call that coordinated care. So again, they're overseeing things. They're directing the care, making decisions, and so they supervise the care. So it's totally different between these two options. The second difference would be when you have a supplemental plan, the whole focus is on high quality insurance. In fact, I would tell you it's exceptional insurance, truly top notch, and that's their focus. It is great insurance, and you have little to no perks. Every now and then we'll see a little perk thrown in, but not usually. Normally we're going to have no perks whatsoever. Now, when we have an Advantage plan, we're going to have a variety of perks. This is one of the things they emphasize. Now, again, I would say this is not high quality exceptional insurance. It is definitely adequate insurance for some people. I would say it's kind of middle of the road average and certainly tolerable, but it's not going to be high quality that a supplemental plan would have. But again, it is going to have a variety of perks. It's going to have a gym membership usually, maybe a little dental allowance or a vision allowance. Those kinds of things come with Advantage plans, not with supplemental plans. Number 3, also, when it comes to providers, and we're going to talk about a lot about providers because this is a big deal. You want to make sure that your providers that you want to go to, your hospital, your doctor, your specialist, you can actually go to them. And so when we have a supplemental plan, you can go to any provider that takes Medicare. You don't even have to ask them if they take your supplemental plan because they're required to. If they take original Medicare, they will take your supplemental plan of choice. Not so when it comes to an Advantage plan. You can only go to network providers because if you go out of network, either it's not covered or it's going to cost you a lot to do it. So that's the way Advantage plans work. They're going to have HMOs and PPOs. So again, a big difference. Number 4, supplemental plans are nationwide coverage. You pull out your A and B card and your supplemental card, whether you're in Alaska or you're in Florida, it doesn't matter. It's going to be the same thing because it's a national plan. Not so with Advantage plans. They're local plans. You have local service areas where local doctors, hospitals are going to take that plan. Okay, now if you go outside the network and it's an emergency, you'll have no problems. But if it's outside the network, non-emergency, you can have some real struggles with the Advantage plans. Number 5. And then a supplemental plan is written for life, can never be canceled by the insurance company except for non-payment of premium. Plus, it's portable. If you're in Denver, Colorado, and you have a supplemental plan, you decide I'm going to move to Tampa Bay, Florida, you take your supplemental plan with you. It's portable, it's lifetime, can never be canceled except for non-payment of premium, right? Not so with Advantage plans. Notice they're an annual plan. They're not lifetime. They change year to year, and the networks change year to year as well. It's a service area plan. It's not really tied to you. It's tied to that metropolitan area. You move out of the metropolitan area, you'll have to get a new Advantage plan. Number 6. Also, when it comes to supplemental plans, notice the word here, no pre-authorizations. Pre-authorization means that your doctor makes a recommendation and the insurance plan must approve that. That never happens with a supplemental plan. If the doctor says you need something, and again, Medicare says we'll cover it, end of story, insurance company is going to pay their part. They have to. So again, they can't delay services. They cannot deny services at all. But notice over here, when we have an Advantage plan, we have mandatory pre-authorizations. 7 out of 10 services, they say right now, must be pre-approved by the insurance company. So doctor recommends, but insurance company must agree and approve before that service is going to be covered. And then number 7, as far as out-of-pocket expenses, when it comes to subs, very predictable. I'll give you some numbers on that here in just a minute. The Advantage system is more pay-as-you-go. Okay, so here we have premiums. We know what they're going to be. We have a minimal out-of-pocket cost. We know what they're going to be. Here, basically what we do is we're taking on the risk of whatever healthcare services we may need throughout the year. So pay-as-you-go versus a premium-based coverage. So let me give you a quick example of our out-of-pocket expenses between these two systems. Now, this particular example would be a real-life example, and it has to do with a 6-day hospital stay. Right now, that's the average time a person that's on Medicare is actually in the hospital. So what will it cost us if we have a supplemental plan versus an Advantage plan? So first off, if I have a supplemental plan, I have a monthly premium for that plan. And again, this is going to vary. I'll show you some numbers here in just a couple minutes. But on the average right now, let's say someone gets a Plan G. And let's say they're paying $150 a month for that Plan G. And so 12 months of that would cost what? $1,800. So that's my premium for the entire year. If I have an Advantage plan, about 2 out of 3 of them actually have a 0 premium. There are a few that have some low premiums, maybe $20, $25, but again, there's a lot of plans that are going to be 0 premium. Okay, so I pay 0 here. Here for the whole year, I paid $1,800. And again, what we're looking at is if I go to the hospital. Now, on deductible on Plan Gs right now, that deductible is $257 for 2025. All right, so we have $257 out of pocket, and that's an annual deductible that we have to meet for the doctor that takes care of us in the hospital. And over here on the Advantage plans, many of them have a 0 deductible. Some of them could have up to about $1,000 deductible. It's going to vary plan to plan. All right, and then we go into daily copays. And so when it comes to a supplemental plan, and when I'm in the hospital, I have 0 daily copays. There's the only thing I have would be the deductible to pay the doctors, and that would be it. Over here, this is where Advantage plans are going to differ. Advantage plan is going to have a daily copay in the hospital, and on the average right now, that's about $400 a day. There could be some a little lower, a little higher, but about $400. So let's go back and look at the total between these two options that we have. So if I have a supplemental plan, I have paid $1,800 for the whole year for my premium to be on the plan. Once a year, I had to meet that deductible of $257 on the doctor side. So that is what? $2,057 is what I spent in the hospital because I paid the premium whether I went to the hospital or not. Pay $2,057 over here. Most of the plans are going to have somewhere between a 5 to 8 day daily copay. Once you reach that limit, then you'd be done on that particular hospitalization. You're rehospitalized, you would pay it again. So let's just say we have 6 days. We're in the hospital for 4 days. That means it's going to cost me $2,400 for that hospitalization. All right? And so here I spent $2,057. Here I spent $2,400. But here's what happens. What's going to happen, how about if something happens to me in 3 months or 6 months later? I'm still within that calendar year. Well, future cost, if I have a supplemental plan, will be 0. Why is that? Well, because I've already met my deductible for the whole year. I've already paid my premium. So if I have another surgery or I have to go into a doctor's visit, specialist visit, anything I do is not going to cost me another penny because I've already paid my premium. I've met my deductible. I'm done. Over here, what's going to happen, if I'm rehospitalized, I could pay another $2,400. If I have a CAT scan, it's going to cost me $300. If I have an outpatient surgery, it's probably going to cost me $400. So again, remember, it's that pay-as-you-go system. And so over here, that future cost is going to continue to go until I hit my max out-of-pocket on that Advantage plan. And on the low side, they're about $3,000 to $4,000 on HMOs. High side, sometimes $7,000 to $10,000. So again, that's the difference. Here, I paid premiums, pretty well done. Here, no premium, but I pay as I go. All right, now that we have a full understanding of these two different systems, now I want to focus on supplemental plans. So the top three is what we're going to discuss in this video. So first off, there are 10 supplemental plan options. They're all given a letter, and each of these letters represent a different type of a supplemental plan, okay, different type of coverage. And so again, we're talking about the top three. Right now, the top three are the F, the G, and the N. Now, I want to clarify something about the F plan. By the way, that was the very top plan for years, but what happened, they changed the rules a few years ago. So here's what happens. If you are starting Medicare 1/1/2020 after, you cannot get an F plan. Those are off limits to you. But if I was on Medicare prior to 1/1/2020 and I want an F plan or already have an F plan and want to switch that, you can still do that, because anyone that started Medicare before 1/1/2020 was grandfathered in before they made the changes. Again, after 1/1/2020, now we're starting Medicare. F will not be that option. So as we talk about these top three plans, if you started here, all three are still available. If we started after 1/1/2020, it'd just be these two that would be available. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, so this next chart shows us why we get Medicare supplemental plans. We've already seen that if we stay in the traditional original Medicare system, there's a lot of advantages to that. We can go to any provider that takes Medicare. We don't have to worry about pre-authorizations. We have lifetime plans that are portable, so a lot of benefits. So why would someone get a supplemental plan and spend premium to do so? Well, because if I stay in the traditional original Medicare and that's all I had, I have a tremendous amount of financial liability. We call these gaps in coverage. And what you're going to notice here, on the A side of Medicare, we have 3 gaps, and then on the B side of Medicare, we have 3 gaps. Now, just as a reminder, the A side of Medicare covers the inpatient side of Medicare. This would be you're admitted to the hospital, or you're admitted to a skilled nursing facility, or maybe you're receiving hospice care. That's what A covers. The B side of Medicare covers everything that would be doctor-related and outpatient-related. So a doctor that you go to see in their office, a primary care doctor or a specialist, or that doctor comes and treats you in the hospital. It is the B of Medicare that pays the surgeons, the anesthesiologists, the hospitalists, the emergency room doctors are all paid through Medicare B. Also, Medicare P pays for durable medical equipment, CPAP machines, oxygen equipment, those kind of things. It also is going to pay for preventive services. And by the way, preventive services is the only thing that Medicare covers 100%. Everything else that Medicare covers, there's always going to be a balance or a gap, and that's what we're talking about here. So these are services beyond preventive. We're going to have a liability. And so you can see what happens. If I go to the hospital, I have to meet a deductible, and all these numbers are for 2025. Deductible $1,676. That's all I have to pay for the hospital stay up to 60 days. But if I'm in the hospital longer than 60 continuous days, now I have daily copays that I have to pay. They get very expensive. These are called extended hospital stays. They're rare, but you can see $419 every day I'd owe for month 3, $838 every day for month 4 and month 5. So we're talking here, $12,000, now it's $25,000 a month. So it's very expensive. All right, the last gap on the A side of Medicare is for skilled nursing. This would be after a stroke or maybe an accident or an injury where we need some fairly intensive rehab. We're admitted for that. Medicare says they'll cover everything the first 20 days as long as I was in the hospital at least 3 full days. They cover everything the first 20. After that, they'll cover 80 more days, but now I have a $209.50 daily copay I'm responsible for. And here's my point. Those are your gaps on Medicare A. If you didn't have a supplemental plan, you would have to pay those. The B gaps are this. The B gap is $257. It's very low. This just means the first $257 of anything coming through the B side, again, the doctor side, durable medical equipment, outpatient side, all that's the B. You'd pay the first $257, and after that small deductible is met once a year, then Medicare becomes an 80-20 plan. Medicare is going to pay 80% of the bill, but now you're responsible for 20% of the bill, and that's your second gap. In fact, that actually is your largest liability in Medicare today, would be that 20% 20% coinsurance, especially if you had some kind of serious illness where you had to have an operation. Okay, 20% to all the doctors. Then lastly, we have a gap called an excess charge. Now, this does not happen often. Actually, less than 5% of all doctors even add excess, so it doesn't happen frequently at all. But if it does happen, that just simply means that that doctor is what we call a non-participating doctor. They don't take assignment. They still can see Medicare patients and can bill Medicare, but they are going to add 15% to the bill. Medicare allows it, but doesn't pay it. You would be responsible to do so. So here's what I'm trying to teach you. We have 6 gaps in Medicare, 3 on the A and 3 on the B side. So what we can do, if we don't want that financial liability, we can take those liabilities, those gaps, and we can transfer that liability to an insurance company, and that's of course called a Medicare Supplemental Plan, and you pay them a premium to take some of these or all these gaps from you. All right, so that brings us then to the Plan F. Now remember, if you started Medicare after 1/1/2020, this is not an option for you. Prior to it would be. And so the F plan is going to do this. It's actually a full coverage plan. It literally will cover every single gap. We tell our clients that on F plans, if you get a bill, do not pay it. You should never get a bill. As long as you're seeing a Medicare provider and are getting a service that's covered by Medicare, you should never have anything out of pocket other than the premium for the Plan F. All right, so it truly is a full coverage plan. I want to add one note to this. As we talk about these plans, F, G, and N, there's one other thing that each of them will do. Remember, we had about 150 days in the hospital covered by the supplemental plan, but after that, Medicare's done. And so that supplemental plan F, G, and N will all give you an extra 365 days in the hospital at no cost to you whatsoever. Now, that's not used very often, but it does happen from time to time, so that's an added benefit with the supplemental plan F, G, and N. All right, so that F plan was full coverage. Now let's look at the G plan. Okay, this is the most comprehensive plan for those starting Medicare after 1/1/2020. It's actually going to cover 5 of the 6 gaps, okay? So you have one that you'd be responsible for on the G plan. So really, the only difference between the G and the F would be on the G plan, you're going to have to pay whatever the annual B deductible is. In 2025, it's $257. Let me just give you a feel for this. 2024, it was $240. So it went up about $17. Of course, don't know what it's going to be for 2026 yet. But the point is, whatever that is, you pay it once a year and then you're done. So after we've paid our deductible, everything else is going to be covered 100%, plus that extra year in the hospital if we needed it. All right, that brings us then to the third plan. That would be the N plan. Again, we have the same gaps that exist in original Medicare, but if someone has an N plan, what that's going to do, it's going to cover 4 of the 6 gaps. As you've seen, F, G, and N are identical over on the hospital side. Where they differ is over here. And so the F, remember, covered all gaps. The G covered 2 of the 3. The N only covers 1 of the 3 gaps on the B side of Medicare. And so if I have an N plan, I'm responsible for the B deductible, just like I was if I had a G plan. But here's the difference. Now I would have to pay excess if and when it occurs. And again, it doesn't happen often, folks. Definitely less than 5% of the doctors are even allowed to add it. So the majority are not going to, so you may never see it. But if you do see it and you had an N plan, whatever that charge was, you would have to pay that out of your pocket. Okay, now I do want to clarify something about excess. There are actually 8 states that do not permit the physicians in that state to add excess. And that would be Connecticut, Minnesota, Massachusetts, New York, Rhode Island, Ohio, Pennsylvania, and Vermont. There's 8 of those states. Now, if you live in those states and you go outside of a state and you have to have a provider that adds excess, you could still pay for it, but you'll never see that within your state, the providers there. Okay, then with the N plan, we also have an additional out-of-pocket expense occasionally. Whenever you see a doctor, you're now subject on that N plan for some copays. So you're subject to up to a $20 copay to a doctor. Now, that copay could be $18 for a certain service or $16, but it'll never be more than $20 on the N plan. Okay, so you'd never see a copay of $25. That's the max. And then if you happen to go to the emergency room and you were not admitted to the hospital, then you would owe a $50 copay on the N plan. As you'll see here in just a minute, of course, the N plan of the 3 is going to be the lowest cost plan. So highest cost would be the full coverage F, and then the G, and then the N. Let's take a look. Now, as we make this decision to be covered by original Medicare and get a supplemental plan, there's something I must point out to you that's critical. Okay. especially those of you that are going to be new to Medicare. What happens when I'm new to Medicare, which means I'm going on Medicare at 65, or maybe I'm going on Medicare at 67. I may have taken A only, but I kept working, and then I enrolled into Medicare B. And so what I want you to see is that when we're new to Medicare, again, whether it's 65 or 67, brand new, what happens is we have this 6-month window, very important. We call this the Medigap OEP, and this is tied to your B date. Tied to the B date, the Medigap OEP. And every state in the country has this law. It's a federal law. And so you have this 6-month window that you can get any Medigap policy. Again, we go back to the, when you start Medicare, but you can get any Medigap policy by any company, and they have to write you. They have to approve your application 6 months of your B date, which means there's no underwriting involved, no health questions asked. They must cover your pre-existing conditions. They cannot add anything at all to your premium because of any health issues that you have going on. You get that true 65 or maybe 67 rate, depending on when you're starting. It's a very important period of time. And so we have no underwriting whatsoever. But here's what I'm trying to teach you. It's tied to the B date. So in this example, this is someone that started Medicare January 1st, 2025. Again, they could apply actually 3 to 6 months in advance. That's why we're saying plus or minus. So we can apply in advance so that when my B starts, my supplemental plan starts at the same time. But if I didn't apply in advance, I still have a 6-month window. So if my B date was 1/1/25, I have all of January, February, March, April, May, and then June. I'm still in that 6-month window, no underwriting required. Now after that, July 1 thereafter, now I'm going to have to medically qualify. But in these 6 months, it could be your once-in-a-lifetime opportunity to get that plan. And I know many of you, of course, have already done that. Now let's talk about those who start Medicare after 65. Let's say they enrolled in a Medicare A only, and they kept working 2 more years, and then they started that B date. Now our 6 months is tied again at the time when I start my Medicare, and so it's 6 months then of January 2027, right? So again, January, February, March, April, May, June, 6 of 27. I can still apply because I'm in that 6 months of my B date. Okay, so it's just a real critical date, and many of you have already used that. Some of you may not. So we just want to make sure you know no underwriting required. But here's what I'm trying to teach you is this next statement, that to change a Medigap policy, many of you are looking at the possibility of doing that, to change that policy after that 6 months of my B date is long gone. Now what happens? Medical underwriting will be required. I'm going to explain the process of that here in just a few minutes, but I want to make sure you understand that in most states, in order for us to switch our supplemental plans, we do have to go through that underwriting process. All right, so that brings us to the options available to us for switching Medicare supplemental plans, because many of you watching this, that's what your desire is to do. So let me show you your options. First off, if you were actually on a Plan F, again, that means you started Medicare before 1/1/2020, but now you would like to switch. You have a couple options. Actually, you can move an F to an F. Some people want to do that. They want to stay on the full coverage plan, willing to pay a little extra to have that full coverage. You can make that move. Or you can move to a G. You'll pick up one gap. Remember the B deductible now you'd have to pay out of pocket. Or you can move down to the N plan. You'd have the B deductible, you'd have the excess charge, and some copays. But those are your options. Now, some of you are on Plan G. You started Medicare after 1/1/2020, or you picked the G plan even before that period of time, which is fine. And so now we can move to another G plan. Maybe your company has increased its rate over the last several years, and you would like to move to a lower cost G plan. You can do that. Or you can move to an N plan, take on the little liability, and even save a little bit more money. Or you could be on an N plan, and maybe those premiums have bumped up a little bit, and now you just want to see if there's a better N plan available to you, meaning one at a lower cost. All right. So those are options. So what I'm going to do now is I'm going to show you some real life examples and show you the savings that people are getting as they use this system. Now, just before we get into those exact numbers, I do want to talk about a couple reasons why people are doing this today. The first one is certainly just to save money, reduce your monthly premium. Your premium's at a certain amount. If we can move to another plan of like or less type of coverage, then you can save some substantial money. You'll see that. A second reason, and really just as important as the first one, would be this one, to improve your rate stability. What do I mean by that? Well, here's what I want you to realize, that when you bought that plan at 65 or 67, you actually went into a group. That's a group of people in your area who bought a plan around the same time, and literally thousands of people started in that group, and most of them were 65 to 67. But let's say you've been on that plan maybe for 5 years or 7 years. You've been on a little while. What's happening in that group? I can guarantee you this, that group is getting smaller every single year. Why is that? Well, people pass away. People change plans. They get off. And so that point is that that group begins to get smaller and smaller and smaller over time. Just simply means that there's less people in the group to spread out the risk of healthcare issues. It's also getting older, which means there's more health claims going on as well. And so one of the reasons if a person can get a different supplemental plan, now they can reset the clock. What happens? We're going to go back in a brand new group that's going to have primarily younger people in the group. They're going to be healthier. And the net effect of that is going to be more stable rates for you. So that's the two reasons. We save money now, but we also going to save money later because we reset the clock and got in a new group. Okay, finally, let's look at some real life examples. First, we're going to start with a situation with a gentleman that was actually on a Plan F. And these are real cases. This particular situation was a gentleman, a man. He was 75 years old. He lived in the state of Georgia, the zip code of 3002. He was on that plan presently, and he's paying $309.82 a month. Okay, he was able to get through underwriting, and so these were his options to go on different plans. He could get a new Plan F, same coverage, nothing changes, but look, his premium went down about, what is that, about $95, a tremendous amount of money on a monthly basis. He also could move down to a G plan. Look what happens there. Now he's saving about $135 on a monthly basis, all the way to an N, again, cutting his premium down by about $170 on a monthly basis. So that's why we're saying it's well worth your time and effort to make this kind of a switch. All right, that's the Plan F. Now let's look at some Plan Gs. Again, some real life examples on Plan Gs. First, we'll start with a lady, a female. She's 69 years old. She lives in California. She's in zip code 90040, presently on a Plan G, paying $234.80 a month. Okay, she qualifies to move. She can go to a G plan. Now you're going to see here, not a whole lot of money initially. She's going to save about, $28 a month. But remember, she's resetting the clock, going in a larger group, and more than likely much younger people as well. So I think she's going to get more stable rates. Save a little bit of money now, but could long-term a lot of money. If she moves all the way down to an N plan, still a great plan, of course. And now she's saving, what is that, about $90 a month by moving down to the N plan. Let's look at another example. Here we have a gentleman. He's a man. He's from Texas, 72 years old, presently on a G plan, zip code 75001. He's paying $194.94 for his G plan. He qualifies to go to another G plan, he moves from like plan to like plan, no benefits or change whatsoever, but he still saved a decent amount of money. What is that, about $45 on a monthly basis. And again, he resets the clock. He can go down to an N, even going to save more money, about what is that, about $85, $87 or so on a monthly basis. So again, it's well worth the time to make that switch. And then lastly, let's look at one more G plan, because this is the most popular plan right now that is on the market, are your G plans. So we have a lady in Florida, zip code 32605. Her G plan is $224.74, moves to an N, so she's going to save about a little over $40 a month. Again, she resets the clock. She goes down to an N plan, going to save about $90 on a monthly basis. So again, well worth her time to take this process through to get that Medicare supplemental plan switched. All right, let's look at just one more real life example of someone that actually started on an N plan, and many have done that, but she can improve her position. And this actually is a lady from the state of Kansas. She's 71 years old. Her premium right now is $173.30, but we found an N plan for $112.34 she qualified for, so she's saving about $60 a month. So again, well worth the time to do this. All right, so that brings us to the process of switching. What's all going to be involved with that? So the first thing I want you to note is this, that you can go to our free comparison enrollment tool right here on this site. In fact, there's a link right below in the description bar where you can actually click on that and you can start this process. Now I'm going to take just a couple minutes to explain what all is involved, but right after that you can click on that link. Now first off, let's talk about what we're going to ask you for you to be able to get this information. We're going to start with just your date of birth. We cannot give you any kind of a quote until we know that, of course. So you'll also have to put in your gender and your zip code. All right, so just a couple basic questions, and that's enough information. You notice there's no private information here, no name, no email address, nothing. It's just these details so that then we can show you what rates are. Now, I want to remind you something about rates. Household discount means that you actually are married or have a significant other, and you actually reside with somebody. And so what an insurance company will do, they'll actually give you a household discount because you do not live alone. And also, if you're married or have a significant other and they're also eligible for Medicare and want to be on a plan, you actually can apply through this as well, and you get another discount that's actually called a multi-policy discount. And so these discounts can be anywhere from 10 to 20% for both of you. So it's well worth your time for both of you to make application to get the greatest discount possible. All right, so you'll see that in the system as well. Now, what we've done after we know this basic information, we know you can get a household discount or not, then you can actually shop plans. You can look at all the different plans on all the different carriers that are in your area. Now, again, if you're starting Medicare after 1/1/2020, you can't be on an F plan. If you're starting Medicare after then, it'll be the G plan. The N plans are going to populate within this system. But here's what I want to teach you. These plans are standardized. So you're going to see multiple carriers that are offering the plans in your area. And so if you had ABC Insurance Company or XYZ Insurance Company, and you say, I want a G plan or I want an N plan, but if you select what plan you want, regardless of the carrier that you select, the coverage will be the same. In other words, if you have a G plan, it's a G plan no matter who you go with. That coverage is the same. They'll both pay the same amount of bills, the same type of bills. So there's no difference with coverage. So we don't select a carrier in hopes that one is going to pay better than another. A G is a G is a G is a G. An N is an N is an N is an N, regardless of the carrier. Coverage is the same. But what's not the same will be the premium. That varies by carrier, as you certainly will see. And so the point is we're shopping plans, but once you've decided what plan you want, then we're going to look at the different rates that those carriers are offering, okay? And frankly, the way I am with all the carriers that you're going to see, I would go with the lowest cost plan, unless you have a certain preference because of some other maybe issue that you've had in the past, a company that you really liked a lot, you can go with them. But I'd still go with the company that's going to give me the most amount of savings because, again, I want to reset the clock. So you'll compare rates, and then you'll actually choose the plan and company that you want to go with. You'll just click on that. And then what's going to happen is going to take you to an application. Now, as you go through this underwriting process, I want to be real clear on this one. There's no medical exams whatsoever. You're not going to have to take a physical to apply. No medical exams whatsoever. All we're going to do is ask you a few health questions, and that's it. These are yes, no health questions. Now, listen, if you're going through this and you come to a question you're not really sure on, you're just not sure, you can skip the question. It's fine because when you go through your verification call, you'll be able to clarify that with the agent, okay? But the point is, answer those health questions and just be honest. And you'll notice that they're very specific about certain health issues, so answer the health questions. Then you're going to have to list out the medications that you take. That lets the insurance companies know what you're being treated for. That's going to be important in the underwriting. And then you'll submit the application right online. Very, very simple to do. And I just want you to know something. From start to finish, this is, folks, most people, this is less than 10 minutes. Some do it in 5. It doesn't take very long whatsoever. But again, you'll submit the application, and at the same time, you're going to schedule your verification call. That's very necessary part of the process. Make sure everything is accurate, and you see if you have any questions as well. We'll schedule the call, and then what's going to happen? The insurance company will have that information, and then if they approve you, they say yes, we're going to issue this policy. Then what will happen? We'll work out the exact timing with you. Let's just give a quick example. Let's say you applied, June the 5th, and you want your new policy to start July 1. We've been approved, and then we would have you reach out to the insurance company that you're with right now, your old policy that you're now replacing. You'd reach out to the insurance company, and you call them the customer service number on your card and let them know that you're canceling that policy effective 7/1. So there's no overlap of premium whatsoever. The old one will be canceled, the new one will go into effect. But we cannot cancel that for you. Agents can't do that. You'll have to initiate the call, but we're not going to do that until we get approved. Cancel out the old, and then the new one will start. You can start saving yourself some money. Now, let's suppose you don't get approved. You actually get declined. Now, sometimes people get declined, and we actually can appeal that, and we will if we need to. But if it truly is going to be declined and there's no appealable type of a situation, then what has happened? Absolutely nothing. You're going to keep your whole policy. In fact, when we make application, that company you're with right now has no idea that you're hoping that you can switch plans. They don't have a clue about it. They don't have to know whatsoever. So again, no one's notified them. You only notify them if you got approved, and if you didn't, you just keep that policy in the same coverage that you have right now. All right, so you can see the process of changing your Medicare supplemental plan is very easy. You can do it right on your phone, you can do it on a desktop, but I would encourage you, if you're healthy enough to make the switch, do it now. Why? Because your health could change in 3 months or 6 months, and then you lose out on this opportunity to actually save some substantial money. The service is totally free to you. Just remember, there's no cost to use this tool. When you get approved, then your cost is you're going to pay supplemental premium to a different company. That's really the only thing that's going to be adjusting, but again, that is going to be at a lower premium. So I would encourage you, go ahead and start an application to see if you can save some substantial money on your MedSup plan.